Hello everyone, welcome Janine. Today we are going to talk about neuro assessment, and today is lesson 3. So like I said, today we are going to learn more about the neuro assessment. When I say neuro assessment, is the Glasgow scale known as GCS. This type of assessment, we use it to assess the patient that are not 100% okay, or maybe they are 100% okay, but everything that has to do with the neurological assessment. Okay, so now we're going to go into depth, but before that, I'm just going to say Glasgow Coma scales involve opening eyes, verbal response, and motor response as well. So let's talk about the eye opening. I am going to walk down from the fourth to the first. Okay, so the fourth one is spontaneous eye opening. So you walk to your patient or you walk to your client and you saw their eyes open. That is spontaneous. And then number 3, to the sound. So you go there and you see that the patient is sleeping, and then you go there and say, hello Mrs., hello Mr., and then they will open their eyes. So they're opening their eyes with the sound of your own voice. Okay, and then number 2 is to pressure. So they are closing their eyes, they're sleeping, or maybe they're not sleeping but they are unconscious. You go there, you call them and they're not answering, and then the next thing you need to do is shake them, or just put your hand here, or just rub gently here. You know, that is the pressure. And if they wake up on it, that means they're waking up under your own touch pressure of your hand. Then the last one, which is the first one, is no response. You go to your patient, you've done all the fourth, the third, and the second one, and the patient is not waking up, nothing. That means the patient is non-responsive. It doesn't respond to your eye command or anything. Okay, so that's it. So it is very important that you know this 4 type of eye opening assessment when you do your neurology assessment. Okay, and now let's move to the second one, the verbal response. So in this one we have 5 types of verbal response. Like I said, I'm going to walk from the very top to the very last. Okay, so the 5th one is oriented. So the patient is oriented, you walk to the patient, you greet, you do 1 or 2 conversation, and you ask which month are we? That is the first, and then he or she will be eager to respond to you. That means he's oriented. What is your date of birth? The person will answer. Where are you? Which month are we? Normally in my own case, I normally say which month are we, and which month is Christmas. So because I just want to know how much they can understand. So that is what we call orientated. Then now let's go for the 4th one, which is confused. So when you ask the patient, where are you? And then the patient will say, I am at home, while they're in the hospital. That's confused. Or which month are we? The patient might say it's April, but while we are in July, which is also confused. Or you ask the patient, are you in bed or are you sitting now? So while the patient is in bed and you're doing this assessment, and the patient will tell you, I am sitting now, that means he or she is 100% confused, and that's what we put down as a confused patient. Now let's go to number 3, which is inappropriate words. So patient might be saying things that they feel that you understand, but to you they are inappropriate. So for example, yesterday I went to the market, and that is a very appropriate word, but then the patient will say, today John went market but bed. Those are inappropriate words. So you know those are inappropriate words. And then number 2 is incomprehensive speech, where they are trying to say something but you can't comprehend what they are saying. ma, ba, 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 ba. That is incomprehensive speech. So that is number 2. And then number 1 is non-response. So you're trying to speak to the patient or the client, and the patient is not responding to what you're saying or to your questions you're asking. How are you? Which month are we? Where are you? These are non-response. Okay. Lastly, we have the motor response, which is 6 inside this motor response. Like I said, I'm going to go from the top to the lowest. Number 6, obeying command. You ask the patient, lift up your hands. The patient will lift up their hands. Close your eyes. The patient will close their eyes. So they are obeying all your instructions. Then number 5 is localizing pain. The patient is not obeying your commands, but if you touch the patient, you ask the patient, where is the pain? And then it will localize it. Number 4 is withdrawing away from the pain. So the patient, you're touching the patient maybe on the wrist, and the patient is doing like this. Motor response of withdrawing away from the pain. You're touching the patient on the wrist and the patient is withdrawing their hand. That is withdrawing away from their pain. Now we have the abnormal flexion, which is something that involuntary inflections. Yeah. And then we have the second one is the extension. And then the last one is no response. When you ask the patient to lift up their hand, the patient will not, because they are trying to, but there is no response. You can see from their facial expression that they are trying to raise up their hand, but because maybe they had a severe weakness, which is very, 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 very dense weakness, they are unable to lift up their hands. Okay, so these are the motor responses that we look for when we do our neuro assessment. Quote, Glasgow Coma Scale, GCS. Okay, so in this lesson 3 we've all learned about neuro assessment, which is Glasgow Coma Scale, GCS, and we had the neuro assessment of a patient, whether unconscious or conscious. Okay, thank you so much, and I'll see you next time with lesson 4. Who knows what topic I'm going to bring? Please use the comment section if you want me to bring one particular topic for you. I love you. Please do not forget to like and share and comment this video. Thank you so much and have a lovely day.